afternoon, everyone. It is 2:30. Welcome to Cook County Health Department Schools and COVID-19 Update. My name is Kelly Jones. I am a health educator senior with Cook County Health Department's Community Engagement and Health Education Unit. I am your host and moderator for our meetings. Let's get started. Of course, a lot has happened since we last met. That's how things have been going lately. Our objectives are to support schools and, I'm sorry, or to support schools while we're navigating COVID-19, answer any frequently asked questions, and provide contact information and resources for CCDPH. We have a few announcements. As most of you probably know, you are here, so I'm sure you got the announcement. We have switched our schedule at the top of the year to a bi-weekly format. If we feel the need to make that change back to a weekly format, then we'll make sure we let you guys know in enough time and make those changes in Eventbrite so we can make the best outcome for you all. Our webinars are all recorded and they are uploaded to our YouTube page as well as our CCDPH's school-specific webpage. So you can go back and reference anything that we have talked about on our previous webinars. We start promptly at 2:30. We are keeping our lines muted so we aren't disturbing our fellow presenters, and we're going to disable the chat until Q&A so that everyone will have a chance to listen to myself and Lex, and maybe your question will be answered during the presentation. Here is CCDPH's contact information. If you'd like to submit any webinar related questions, please make sure you send that to the CCDPH_schools at cookcountyhhs.org. I've been getting some questions personally. I try my best to forward them all to the CD department and to that that email address when possible, but I'm not always able to catch those emails. So if you can make sure you send those to the proper place, we can make sure we get your questions answered right away. If you have any line list that you want to I'm sorry, I said the wrong email address. The general email address is the first email address up there. Submit any webinar related questions. If you want to report any line list or communicable diseases or any metrics questions, that's the CCDPH_schools email address. And then here's email addresses and websites for more resources for CCDPH. If your school participates in the EpiPen request program, you have any questions about EpiPens you'd like to apply, please contact me and send those requests to kjones1@cookcountyhhs.org. Please make sure those requests come from a medical professional, i.e. your school nurse, or someone who has been trained and certified in the administration of medication. Please type all those requests and our doctor will provide you with a signed prescription and standing order for EpiPens. It is up to you to fill those prescriptions based on whatever your administration has set forth. As you all know or may not know, that now the administration, the government has put out the COVID test that you can get at home. The website, I think, came up on Wednesday. So each address is eligible to get 4 free COVID-19 tests. They're completely free. You can go to the covidtest.gov website to request it. I believe they said the turnaround time is about 2 weeks. So it's 4 per address. I'm not sure if there is a cycle for example, 4 per address per couple months. I'm not sure about that, but all of that information is on that website. Also, the Binax rapid tests are available for private use in pharmacies. And I believe a couple weeks ago, it was made to reimbursable from your insurance. So you have a couple options. You could either go to the pharmacy and they could run your insurance. And then if it's covered, then you could get it right then and there, or you can buy it and then submit to your insurance for reimbursement. So you have a couple options there with those COVID tests. Also, for schools and organizations, Cook County Health Department participates in the rapid antigen COVID-19 testing program. So you can click the following link to request that, and Dr. Corpix will be on hand to answer any questions you have, and she can help you set that up. If you have any concerns about testing sites should be free to the patient. Ideally, there are some testing sites that charge an administrative fee, which is a way for them to frankly get a little bit of money for their services, but the testing should be free. and as providers can receive reimbursement for those testing. If you feel that there's an issue with a testing site that you go to, please contact your municipality to report that. And also you can contact the Illinois Attorney General's office at the following number to file a complaint. If you're interested in shield testing through IDPH for your organization, you could email that address dph.antigentesting@illinois.gov to make a request. Cook County Health Department has reopened our mass vaccination sites. We have reopened our vaccination site in Forest Park, formerly Hobos on Roosevelt Road, in Matson, formerly at the Target on Promenade Way, and tomorrow the Des Plaines location, formerly at Kmart on Oakton Street, will be open. Also, I don't have a slide for that, but we are in the works for opening a mass testing site in Oak Forest. Hopefully in the next few weeks, we'll have all of those details hammered out and I'll be able to present the information about that mass testing site coming up. If you're interested in any events that we have coming up for CCDPH, you can check out our events page on our calendar. And here's just a little screenshot of what we have coming up the next couple days. For information on hosting a school clinic, you can find all that information on the slide. You can email teamequity@cookcountyhhs.org to get started. Here's just information that you can download to find out how you can best host a vaccine clinic. It gives you a few tips and tools. Here's just more educational resources on youth and COVID and how safe is the vaccine and questions and answers about the variant. You can find all of those flyers at the following link at the bottom of the page. Just some YouTube videos advertising what we've been doing within the community. They're really great, so you can check them out. Take a look at it when you get a chance. They are all on our YouTube page as well as our My Shot campaign. If your organization would like to have a speaker come to speak about COVID-related issues, please fill out the Google Doc at the bottom. It'll ask you a few questions to make sure that you are matched up with the perfect fit about language and capacity and amount of people. There are free rides to your vaccination. You can call the vaccination destination number in order to set up those free rides. If you cannot leave your house, if you're homebound, 65 years and older, have a disability, or you use adaptive equipment, you can request to get your vaccination at home. There has been a caveat added that persons who live within the home of that person who's getting that vaccine can then get a vaccine at home as well. So you can find that information at the following link. That is it for me. I am going to stop sharing and toss it over to Lex. I missed one point in your slide set and information that I will give you guys. There will be a link from IDPH on the expansion of the Binax testing expiration dates. There has been a new development with that, so that'll come with the slides that I will send to you all later.
Thanks, Kelly. Basically, this is just a big update to the presentation you saw 2 weeks ago on the new IDPH is calling it the 5+5 guidance. So on the new isolation guidelines and the new quarantine guidelines, and then the troubleshooting that we've run into over the last 2 weeks, questions we've been getting that are great questions that I want to answer for everybody so they know the policy, things like that. You guys know the drill already with this. And just a reminder to put a very specific subject line on your email, since there are several of us that respond to the school email and we respond to different things. For example, I answer guidance questions. And so it's easier for me to know what emails I need to pick out if guidance or question is in the subject line. And then if one of us is out on PTO or out sick, then whoever's filling in for us will know which emails to take. It makes our lives a lot more organized, and it's definitely made the system a lot speedier in being able to reply to you guys. And then this is just something I wanted to go over. This is an old New York Times graphic, but it's still relevant for COVID today. Just because we've gotten a lot of questions about people who continue to test positive, even though they're no longer infectious. And this is a great graphic to go over for this. So that yellowy orange line is the viral load somebody has, how much virus is in their throat and nasal cavity. From when you're exposed, obviously that goes up, and that peaks, especially with Omicron, right before symptoms have even started. So that's when you are shedding the most virus, that's when you're the most infectious. But then you get to a point, whether you continue to have symptoms or not, where the viral load has been diminished enough to the point where you're no longer infectious, but your body is still breaking apart the virus that's currently in your nasal cavity, your throat, and tests, because they're looking at detecting the genetic material um, of the virus, or whether there's pieces of virus present, can't tell you whether those pieces it's detecting are viable pieces that could infect others, or the bits that have broken up throughout someone's healing process. So for a lot of people, 3 weeks is about the time they would keep testing positive, but that can be for up to about 3 months, as some of you have seen. So that's why we're not necessarily worried, and we're not requiring a test to return after day 5 if someone's tested positive, because the chances of them testing positive still are very high. It's very likely that those are not bits of viable virus, but rather just pieces that the tests have picked up because they're pretty sensitive tests. So that's just kind of a breakdown of one of the curves we look at as epidemiologists, thinking about when to let people go back, when they need to get tested, why people continue to test positive, things like that. All right, metrics update. We are worse off than we were last January, as you guys know, but knock on wood, we may have rounded the curve. That is still preliminary data, but we may be on the other side of the peak, hopefully. Can't say definitively, but we seem to be heading in the right direction. That's still, just barely over the curve, so there's still a ton of cases, but things are looking a little bit optimistic. I don't want to be burned being optimistic again, but hopefully things get easier from here on out. We are still at a really high case rate. We are still at very high test positivity. We are at, high doesn't even begin to cover the level of community transmission we're at. But right now, we have fewer active school outbreaks than we had the last time we spoke, which is great. On that note of high community transmission, a lot of people have emailed with multiple cases in a classroom that don't seem to be connected, but they're worried there's an outbreak. And these students sit nowhere near each other. Because of the high level of community transmission, it's very possible to have what we would have considered an outbreak number of students that are completely unrelated. They were just infected in the community, at church, at a family gathering, things like that. So the outbreak worksheet that we send over when you're worried there might be an outbreak takes you through those considerations. And I just want you to know that we're seeing this all over the county, just unrelated, lots of cases in classrooms. And that doesn't mean your school is doing a bad job protecting the students. I just wanted to put that out there. We just are in a really high level of transmission, and that's translating into schools. We are entirely in orange, as we were before. We would maybe be red even. The CDC travel guidance is basically updated to include the new 5 to 10 days, but it's pretty much the same as it has been. Students can return right away after travel, but it's strongly recommended they get tested, and if they develop symptoms at any point in time after they return, then they need to be isolating. And again, cautionary tale, do not go on cruises. Do not recommend people go on cruises right now. That is probably the worst form of travel at the moment. All right, so going into the new isolation guidelines, this will be a little bit of a summary, and then there is a little bit of new information. So this is for anybody who was tested positive. It is for anybody who has become symptomatic after having documented close contact, and that is regardless of vaccination status or age. So if a probable case or a confirmed case with a test they need to isolate for at least 5 full days. Day 0 is the day the symptoms began, or the date of the positive test if they were asymptomatic. And day 1 is the first full day, that first 24 hours in isolation. So that's how we're counting. If no symptoms, if the symptoms go away, or they continue to have no symptoms, or their symptoms have vastly improved, then they can return on day 6. If they're not feeling well enough to return, or they're not going to be good maskers, then they'd return on day 11. And as per usual, that's fever-free, diarrhea-free for 24 hours without the aid of medication. If they return early, for the next 5 days, so days 6 through 10, which would complete the full 10-day isolation period, they need to wear a mask when within 6 feet of others when indoors at all times. In the classrooms, that's within 3 feet. But if you are in a situation where there might not be masking well, that's got to be more than 6 feet away. So they do have to avoid people who are. Oh, I thought I updated this example. But I'll talk about this in a second. So they have to avoid people who are immunocompromised or at high risk for severe disease. What is meant to be put in the parentheses is a link to any conditions that might constitute high risk for severe disease. This doesn't mean to say that if a teacher is pregnant, nobody gets to return early. There are things we can do to accommodate that, and I'll talk about that in a little bit. But if masking is not possible because someone has an exemption, they're not good maskers, or something like that, they should be excluded for the full 10-day period. And then if they develop new or worsening symptoms after returning, they have to go back to isolation immediately, and we start those 5 days over. So there is the example that, just in case people need an example of counting, because I know that can be a little bit confusing. This is the isolation flowchart from Maine. It still stands correct. And then for new quarantine guidelines, just a reminder that not everybody needs to quarantine who has close contact. So ages 18 and up who are up to date with their COVID vaccines, which means they are eligible for a booster and they got it, or they're within 5 to 6 months of their completed vaccine series, or the primary vaccine series. Those are people who do not, and this could be your seniors, this could be your staff, those are people who do not need to quarantine. And then ages 5 to 17 who are vaccinated with their primary 2 doses, they do not need to quarantine as long as they're 2 weeks out of their second dose. People who have tested positive in the last 90 days, because natural immunity tends to be, it varies by individual, but on average is about 3 months of providing good protection, and then after that, it doesn't provide very good protection. And then even if you are a close contact who wouldn't need to quarantine, you still need to practice good masking indoors. If you want to get a test or would feel more comfortable getting a test, that is also fine. But the people who do need to quarantine is everybody else, including people who are eligible for a booster but haven't yet gotten boosted, those who are unvaccinated, or those who are not yet through their primary vaccine series. They might be in the middle of it. So quarantine length is 5 to 10 days with a 5 at minimum, with day 0 being the date of the last close contact with the case with whom they were exposed. So the standard length is 5 days for those who don't have any symptoms. And if they can be consistently and correctly masked, remember that is the big factor, they can return on day 6. Otherwise, quarantine length is 10 days. There is still test to stay available. More on that later. This is just from the IDPH guidance that goes over the vaccine requirements for having to quarantine or not. So that is out there. Quarantine flowchart still holds true from the Maine CDC. All right, and then this is the new information if you need to take any screenshots or anything like that. This is all the stuff we've run into over the last 2 weeks, all of the troubleshooting that has popped up. So as I mentioned, the most important aspect of the early return is that there has to be 100% correct and consistent mask use for the full 10-day period. Masking is the condition for early release because about 1/3 of people are still infectious after 5 days. The majority aren't, but there's still that third, and we don't have a good way of identifying who those people are that are still infectious, because it could be someone who's asymptomatic, it could be someone who has a really bad cough. There's not that much consistency with indicators to help us know. So if someone's returning on day 5, masking has to be really, really good to protect everyone else around them. So if 100% correct and consistent masking isn't possible, they need to take the full 10 days. That is absolutely the requirement. So for those returning early, they can still participate. This is new information from IDPH. Those returning early can still participate in extracurricular or curricular competitions and performances on the condition that they can stay that 100% correct and consistently masked for those activities. If it's a band concert and they play a wind instrument, there's a 6 to 9 feet distance requirement to accommodate, but they can still do that. Sports where masking isn't possible, such as wrestling, are not eligible to be participated in for within those 10 days. You have to wait till those 10 days are passed. That would be swimming, wrestling. I don't think gymnastics allows masks, things like that. If you know you have a player, especially in indoor contact sports, where masks slip frequently during play, and I know a lot of times it's not their fault, it's just hard to keep a mask up when you're sprinting and sweating. So like basketball, because we've seen a lot of basketball cases, consider waiting for the full 10 days for allowing participation in games or competitions or tournaments. If you know they're not going to be able to 100% mask. That is on you guys, the school, to guarantee that masking. When you allow someone to return early, you're saying that you trust them to be good with their masking. And if that can't happen during sports, you should have them do the full 10 days. But there are lots of alternative ways to practice, to attend extracurriculars that accommodate masking requirements. There's conditioning, 6 feet away from others, cheering on from the sidelines. There's reviewing film. There's virtual participation if it's like Scholastic Bowl or something. There are lots of ways to accommodate the masking requirement. It doesn't mean they don't get to see their teammates and their friends for the full 10 days. They can still attend. Coaches just need to accommodate this requirement. All right, next bullet point. If symptoms are present and there is a positive test, you can count from symptom onset for up to 48 hours prior to the test. We talked to IDPH about this because a lot of people have oh, I remembered 5 days ago I had a headache, so I can just come back now. People have been trying to get around it in that way. So we are saying if symptoms started 2 days before their positive test, you can start then. But if symptoms started before that, we're not counting them. Could have been a cold, could have been they ate something funny, but we don't want to be counting from symptoms that didn't belong to COVID, and now someone's actually still infectious after they've returned for those 5 days. So I've had a lot of questions about that. That is out there now. Next bullet point, if returning after 5 days will put the case or close contact in contact with somebody who is at higher risk of severe disease. Oh, here's the link for it. There are a couple things you can do in this situation. First, discuss this situation with those who are at higher risk so that they can take measures themselves to protect themselves. So whether that's a teacher to be pregnant, whether there is someone who is on chemo in the class, or someone is on dialysis or things like that. Make sure they know what the situation is so that if they feel like if someone returns early, they're not going to be safe, they can take the measures to protect themselves. And there are ways to accommodate them even when you have someone at high risk in the class, like rearranging the classroom to accommodate more distance or things like that. If it's not possible for the case to avoid those who are at higher risk, and those at higher risk are like, this is really going to put me in danger, you can notify that case that due to someone being at high risk, they have to return after the full 10 days. And you can do this without revealing any sensitive health information. You don't need to reveal who is the person who's at risk or why they are at risk. You can just send out that that is the reason, and that is a valid reason that needs to be respected. Okay, couple more clarifications. I know this is nuanced and a lot of information. All right. Students that cannot consistently and correctly wear masks need to quarantine for 10 days. This mostly applies to younger children who can't mask well, people with mask exemptions, and this is importantly regardless of vaccination status. So there's that. All right, household contacts in quarantine in days 6 to 10. People with COVID should continue to wear a well-fitted mask around others at home and in public for those 5 additional days. So it's not just when they're in school. When possible, they should be wearing it at home around others, not when they're like alone in their bedroom, but if they're like sitting watching TV or something like that. People that are exposed to someone with COVID after they complete the isolation period aren't considered close contacts. So there's the deal with household close contacts. They should still wear a mask when possible. The school guidance, FAQ, and testing guidance documents were updated to align more closely with CDC on restrictions after release from isolation and quarantine. Basically, students returning from exclusion can resume all activities as long as they remain asymptomatic and mask at all times. Same thing we've been saying. This includes riding the bus. That should not be a barrier to getting kids back in school, extracurricular activities, lunch, snack time, things like that. Students who participate in Test to Stay should avoid competitions and performances until the end of the testing period. That's a general rule. I know sometimes that's not possible if you have a curricular band performance, things like that. But for the most part, they shouldn't be competing with other schools. And then lastly, CDC has updated their isolation and quarantine guidance, separating recommendations for those with confirmed COVID within the last 90 days. So they tested positive using a viral test. And those who are up to date on their vaccination, they are no longer recommending testing 5 days post-exposures for those who are within those 90 days. And that is because you can keep testing positive, as I mentioned at the beginning of the presentation. So testing and isolation continue to be recommended with any new symptom development. All right, this is the same as last time for lunch and snack time. If someone's going to remove their mask around others who is supposed to be in isolation or quarantine is within that 10-day period, they have to be 6 feet away from others. This is extremely important. If the lunchroom isn't set up to have students 6 feet apart as a default, they can't eat in that lunchroom. You can create a specially spaced area and you can have them invite their friends to eat there with them. So you don't have to, feel like, oh, people who have COVID have to eat in this room. You can do that, but that's not how you have to handle it. There are lots of ways to accommodate this. And then if a student who is in that 10-day period needs to eat or drink in the classroom, especially if they're managing blood sugar issues or things like that, they need to be 6 feet away from others. My partner who teaches physics set up a area in the classroom that is 6 feet away from people where people can go to eat their snacks or drink something if they need to, or you can just ask them to go in the hall real quick, eat their granola bar, come back in. If these accommodations can't be made in the school setting, and I understand there's a lot of space limitations, it's totally reasonable to say that our school can't accommodate this because of staff or because of space, then isolation and quarantine should just be the standard 10 days for that school, and that's totally a fine policy to take. Adaptive pauses and remote learning. A lot of places have felt the need to go into adaptive pause right after the holidays because they were so overwhelmed, and I just wanted to say that we do support strategies to keep students in school for in-person learning, but understand that pauses might be needed in certain situations when, like, over 10% of your staff is unavailable, or there's a school-wide outbreak that you just can't get a handle on. There's no definitive threshold for going on a pause at this point, but you know your school best. If you are having logistical challenges and can't keep a school safely open because you don't have staff or there's an outbreak that's uncontrolled, um, then it's totally fine to take a pause. And I just want to say, if you're picking a time for an adaptive pause, the recommended length is like somewhere between 5 to 10 days now, now that we've shortened everything. So not a full incubation period, not the full 14 days anymore. It is ultimately up to the school to decide when they come back, but 5 to 10 days is pretty standard. And then I mentioned this last time, but please don't use test positivity as a part of your considerations, because positivity rates were artificially inflated when schools stopped screening programs because there are fewer negative tests to go along with this. It'll take a little bit for the numbers to mellow out again. So that's on adaptive pauses. And then Kelly, go ahead and open up the chat for Q&A. I'll start with the submitted questions. So first question is about the 47th FAQ on ISBE's document, and is basically asking to clarify exclusion and how that applies to home tests. And the answer is, provided you have documentation of the positive home test, so that would be a picture. Home tests are still viral tests, and so someone who is tested positive should not participate in screening or shield testing for the next 90 days, because they'll just keep popping up positive for a while. They don't need to quarantine due to close contact, which is what the exclusion means, unless they develop symptoms. If there's no documentation of the test, which I know is tricky because those test results get wonky after about like 15 to 30 minutes after the test has been taken, so really encourage people to take a picture of their test after it's developed in the first 15 minutes. They'll need to be excluded from school due to close contact if there's no documentation of that positive test. We can't go off of word of mouth at this point. We need documentation. Otherwise, we can't look back and say we've made correct decisions. Give me 1 second. I got a bit of a scratchy throat here. All right. Next question. What are we supposed to do with unvaccinated students who tested positive on home tests over winter break, but never got confirmatory tests? So this is basically the same question as one, but also in addition, they said that somebody tried to get a confirmatory test after a home test, but the PCR was negative. And I just want to say, in that situation, if you've got a negative PCR in the 48 hours after your home test, you are not considered a case, especially if you got tested because you have symptoms. If you've got symptoms and the PCR is negative, there's a good chance those symptoms are from something else entirely. Third question. What is being shared with local health departments about reinfections within 90 days? We've had several students that tested positive a few months ago that are now symptomatic again after exposures, and some of the pediatricians have considered it reinfection. Some of these students had documented negative tests after their initial positive, so we know it's not that they're just still continuing to test positive. And our response is, please report any suspected reinfections to us. Regardless of previous infection and vaccination status, someone who develops symptoms after known close contact is considered a probable case. Delta is, we're not entirely overtaken by Omicron. It's been a process. Delta was still frequent in the community in November and December. So reinfection now that Omicron is our main variant is not unusual. So that is something to keep in mind. Please report suspected reinfections to us. All right. It looks like this goes a little lower than I would have liked. Okay, submitted questions continued. Has IDPH, CCDPH considered any changes to exclusion for household contacts? It's spreading like wildfire through households, and it doesn't matter if they're vaccinated or boosted or not. That is totally documented by the evidence we have. We know it goes through houses. That's the main way that it spreads. We have vaccinated asymptomatic siblings coming to school, and within days they're positive too. So basically, the question is, can we make some sort of testing to return requirement for household members? So I want to add that districts and schools can require a test for household members if they would like. You can pick policies and rules that are more conservative than what IDPH and us at CCDPH are requiring. But with the caveat that it's not recommended to test those who have been infected in the last 3 months because those positive results might not mean anything. So there's that. And then a similar question, now that we've adopted the 5+5 guidance, we're seeing a lot more parents choose to not have their symptomatic students tested and just keep them at home. So we're never finding out if they really have COVID. Can there be some sort of rule that if they don't get tested, they're just out for 10 days? Again, districts and schools can add rules that are more conservative than we have, as long as they're, informed by evidence that we have on COVID-19. So if that is something you would like to do, that is totally fine. We will be doing kind of the bare minimum here of the 5 days. So keep that in mind. I would like to know if school districts have to adopt the new 5-day quarantine. We have many issues with masking, distancing, parental compliance. We hear this all the time. If you know you have masking and distancing issues, you can choose to require the full 10 days for isolation and quarantine. You can make that a school policy, and we have no problems with that whatsoever. All right, these questions were the bottom of the other page. What do we do if a student opts out of outbreak testing? We've had this question a lot. They'll have to be excluded from school in lieu of testing in the outbreak situation. If it's a situation where we haven't yet declared an outbreak or we're not sure if there's actually an outbreak yet, you're being proactive in this situation, they don't have to be excluded until that outbreak is declared. So if it's for sure an outbreak situation, they'll have to stay home. If we're not sure yet, they can selectively remain in school. What are we supposed to do with students who are testing negative on PCR and antigen, despite having very clear COVID symptoms and known exposure? Can we consider them probable, despite not having a positive test? So, first thing, close contacts have to quarantine for 5 days. Full stop. If symptoms develop in those 5 days, so people have developed COVID-like symptoms, they need to take that full 10 days. They have to have 5 days of their own isolation. There's not a testing requirement. You can't test out of quarantine if you're not in like a test to stay situation. If they test negative after the full 10 days, they can return. But basically, from our perspective, they're considered a probable case if they've got documented exposure and they develop symptoms. Some districts are saying they're moving to accepting antigen tests. I'm assuming this is for symptomatic return. CCDPH still requires PCR to clear symptomatic students to return. Is this correct? When not all districts in the area are on board, it's becoming difficult when parents have students in multiple districts. So PCRs can absolutely be trusted right now, especially if you're symptomatic. It's still highly accurate. I know it's difficult to get PCRs right now, but they are still trustworthy tests. And CCDPH is still requiring PCR to clear symptomatic students if they want to return before 5 days if they have symptoms. And this is due to our community transmission levels. Right now, in this current environment, if you have COVID-like symptoms, especially multiple COVID-like symptoms, there's a high likelihood that you have COVID. Like, just the probability that you have it is way higher than it has been in the past. So that's why we're still requiring PCR to clear symptomatic individuals. There's just so much more COVID compared to flu, compared to other respiratory viruses. There's still that possibility, but right now it's COVID by far dominating everything. So we are still requiring PCR. If you are allowing antigen tests to return symptomatic students, that is against CCDPH policy. IDPH allows for jurisdictions to be more strict if they've got really bad transmission, and we do. It's part of being in a more populated area compared to the rest of the state. So for CCDPH, PCRs are the way to return, but otherwise you only have to sit out for 5 days. Honestly, getting a PCR to return would probably take almost the same amount of time. So there's that. All right, that is everything in submitted question. I have the usual references for when these slides get shared to you guys. I will stop sharing and take a look at the chat. Just bear with me for a second.
While you're looking at the chat, I see the first question is regarding Binax. So for those who missed that announcement in the announcements earlier, Abbott Labs and IDPH submitted a document expanding the expiration dates of some lot numbers of Binax. So that list will be attached to your handout so you can reference the lot numbers you have and see when the new expiration dates are. Thanks.
All right, second question. Some of our parents want their positive children to continue to participate in shield testing so that they can find out when they actually test negative. It's not a good move because even if you are recovering from COVID and you test negative, it could just be the luck of the swab at that point in time. Your virus doesn't or your body doesn't clear virus at like some consistent rate. It depends on your general health that day, how much you slept, like if you've been eating, there's a lot of factors. So, someone who was tested positive in the last 90 days should not be participating in screening. There's that. Can you please confirm what is the correct isolation for vomiting and diarrhea? If someone has the symptoms of vomiting and diarrhea, they need to be excluded for 5 days because, especially for pediatric cases, about 25% of pediatric cases, especially with Omicron, have stomach issues as their main symptom. So they do need to be excluded for 5 days or get tested to return early. But per IDPH policy, you only need to be diarrhea-free and fever-free without the aid of medication for 24 hours prior to returning if you've already been excluded for those 5 days. So if that is what the question is, it's 24 hours before you return. If it is just if you have vomiting and diarrhea, you need to take those 5 days or get tested. All right. Next question. A student tested positive in November, so it has not yet been 90 days. Student was a close contact outside of school. Student is vaccinated. Student has symptoms. Their healthcare provider was contacted and says that it may be too soon to get COVID again, but tested the student. Rapid results were negative and PCR is pending. Is there still the same protocol even if they are within 90 days of testing positive? Yes, anybody, regardless of vaccination status, regardless of whether they're in the 90 days, if they develop new or worsening symptoms, need to get tested and they need to be excluded for 5 days or until they get that negative PCR result. Especially, like I said, in November, there was a whole lot of Delta going around, and if you're towards the end of the 90 days, it's certainly a possibility to get reinfected with Omicron. Let's see. Can you discuss guidance with return to sports? I know IDPH is working on some updated guidance for music and sports, but if you're referring to like athletic clearance to return to sports, that is IHSA policy. There is a elevated risk for myocarditis and heart problems, even if you had an asymptomatic infection among athletes. So it is really important to get cleared by a doctor to return to play if you've had COVID. I know that can keep some people out of playing longer if there's longer wait times or there's a financial barrier to seeing a physician, and that has been brought up with IDPH, but right now that clearance policy is still in place, and it's to protect athletes from having some kind of heart or lung episode while they're playing. Let's see. Sorry, I lost my place when a new question popped up. Okay. If all household members are up to date on their vaccines and then they do not need to quarantine if they're asymptomatic. Yes, that's correct. If you're up to date on your vaccines, then you do not need to quarantine as long as you feel fine. Let's see. Students back on day 6 after isolation or quarantine can return to sports if fully masked. That is correct. But again, you're taking on the risk if they aren't really fully masked because they're bad at masking, or the nature of the sport makes wearing a mask really difficult. So keep that in mind. Students participating in Test to Stay cannot return to sports until the testing regimen is complete. That is correct. In a household where one is positive and out of isolation on day 6, are the other members considered close contacts from days 6 to 10 or only through day 5? That's a great question. They are only considered close contacts through day 5. So day 5 is the last day they could be considered as exposed to that household member. So the minimum household contact would need to stay if they're unvaccinated is 5 days while that person is sick because they're continuously being exposed, and then 5 days for their own quarantine. So 10 days total is the standard for household contacts now, which is great because it used to be like 21 depending on the situation. So yeah, from day 5. We would like clarification on testing if a staff or student has tested positive. Do we wait the 90 days before testing staff and students again? That's correct. So if you've got a screening program and they've tested positive in the last 90 days, shouldn't be doing the screening program. Or if you've got a staff member that has to get tested weekly because they're not vaccinated, they do not need to get tested weekly during that 90-day period. But as soon as that's up, if they're still not vaccinated, they have to take up that program again. Our district halted testing for 90 days after a positive case. Then we were advised to go ahead and test, not wait the 90 days. We are confused. Can you clarify further? If someone develops symptoms, whether they've had an infection in the last 90 days, whether they're fully vaccinated, if someone develops symptoms and has known close contact, they need to get tested if they want to stay in school or stay working. That is the situation where they should get tested in those 90 days. Otherwise, they shouldn't get tested in the 90 days. ISB FAQ number 43 says that rapid antigen tests are acceptable for symptomatic individuals. So we switched and accepted rapids to return with symptoms, but based on this webinar, we need to switch back to accepting PCR, correct? That is correct. So if you read later down in the document and in the decision tree, that will say that local health departments can choose to be stricter about which tests they accept. And because we're in such a populated area with such high transmission, we are currently only accepting PCRs. Until we are doing better with our transmission levels all around, we won't be accepting antigens. I am optimistic about the spring, hopefully. So hopefully. Have you seen an increase in Miss C and Miss A recently? Should we only be concerned about that with those who had COVID within the last 6 weeks? Or could someone get it if they had COVID more than 6 weeks ago? For Miss C and Miss A, you usually get it while you are symptomatic. So we mostly see that among people who have had COVID within the last 6 weeks. And there have definitely been an increase in hospitalizations, and you can see this on our website, our data website for COVID. There's definitely been an increase in pediatric hospital admissions for COVID-like symptoms, but to my knowledge, there hasn't been a huge uptick in Miss C. It's definitely still something we're watching and we're reporting on, but the more we learn about it, the more, while it is definitely a traumatic experience at the time, most people do fully recover, which is great. Returning to sports, day 6 to 10, they need to be masked. Do they also need to remain distance, 6 feet? No. To return early, the only requirement is masking. Distancing would be great. That is definitely a strong recommendation, but masking is absolutely required, non-negotiable. Will there be an updated exclusion tree? Yes, there will be an updated exclusion tree, but IDPH is waiting to update it for when CDC updates their daycare guidance. So IDPH isn't going to update daycare guidance or childcare guidance until CDC does, and at that point they will change the decision tree to reflect that, because that is the general guidance that daycares are directed to use most of the time. So that is the holdup with the exclusion tree. If you were really using the exclusion tree before, I would recommend, I think I have this. No, I didn't have it pulled up. There is just that like written exclusion guidance, which has what the decision tree comes from. Let me see if I don't have it in my favorites immediately, so I can't share it, but they updated that document, so go off of that. IDPH states should test on or after day 5. Does CCDPH concur, and it's not required after unvaccinated close contact. It's not required to return, and that's also IDPH policy, but if they're able to get a test after day 5, that would be fantastic. We have seen a lot of resistance to testing from parents through you guys talking to us. We do know that that can be a barrier. So we're not requiring a negative test after unvaccinated close contact, but it is strongly recommended. And it is required if they want to return after they develop any symptoms over those days. Why is PCR required to return if symptomatic, if all test to stay tests are antigens? So because with test to stay, you are asymptomatic the whole time, that's a requirement, and you're performing multiple tests, the trust that you have in the accuracy of those tests goes up the more they're taken for antigen tests. So if you're asymptomatic and you have multiple antigen negatives, we are fairly confident that it's totally fine for you to remain in school, do your things. But if it's a one-off and you're symptomatic, PCR is going to be the most accurate test for that situation, especially in light of having symptoms. Like I said, the likelihood of having COVID, if you have COVID-like symptoms at this point in time in suburban Cook County, is very high, way higher than it has been in the past. All right, I have not seen any more questions, so Kelly, if you want to start rolling, I can answer any questions that pop up in the chat in writing.
Sure. I just wanted to reiterate the announcements for the people who joined late that there's some information on the mass vaccination sites that Cook County Health Department has opened this week. Information on how you can request the COVID rapid tests for your home use and how you can procure them from the pharmacy through your insurance, as that is now a new law. And also, I'm sorry, there was a question that was answered. I'm sorry, it distracted me. And then also the updated expiration dates for the Binax tests. And Cook County Health Department is also in the process of organizing a mass testing site. Hopefully by the time we have our next meeting, I'll have all of that information. I'll be able to share the slide, and then you can share with your students and staff and families who need assistance for that testing information. That is all from me. I think I see 2 more questions in the chat we have time for if you wanted to address those, Lex.
Sure. All right, I'm going to start. I answered, this might be applicable to everybody, so I'll reread this question. Please confirm that someone who is a close contact or positive who returns after 5 days can play a wind instrument if spaced 6 to 9 feet apart. Yes, they can play a wind instrument. I myself was in curricular band at one point. And as long as they are safely distanced, and that's in the music guidance, I think 9 feet is for trombone players and vuvuzela players, I think. As long as they are properly distanced, they can keep participating in curricular band, especially. And then just, while they're resting for long periods of time or in between pieces, or when they're putting, their instrument together, taking it apart, they need to be properly masked during those times. So yes. If a student tested positive in December, there is a positive case in the student's case, and the student has COVID symptoms, do I send the student to the doctor? And the doctor decides whether or not to test. If someone develops symptoms, I'll say it again for everybody, if someone develops symptoms, regardless of vaccination status, regardless of diagnosis in the last 90 days, If they develop new symptoms, they have to get tested and they need to be excluded until that test comes back negative or for the 5 days. That is for everybody. What happens if an individual is symptomatic 3 days prior to test collection? Can we start the isolation period from there, or only 2 days prior at the earliest? Yeah, I asked Judy this question, or I asked IDPH this question on Wednesday, and they said to just start counting from the 2 days prior, even if symptom onset was maybe 3 or more days prior. If a person tested twice, first positive, second test negative, PCRs within 1 day apart, person is considered positive. Correct. That is correct. When you're talking to PCRs, a positive is a positive. There's no exceptions to that. Please clarify, this seems to keep changing. A positive antigen followed by a negative PCR means what? That's a good question, and the answer depends on your close contact situation. So if you are asymptomatic and you're not a known close contact, then a positive antigen test followed by a negative PCR within 48 hours means that you're negative. If you are a close contact or you have symptoms, it doesn't matter that there was a follow-up negative test, you are considered positive in those situations. Hopefully that, I know it's the let me see if I have this actually documented for you guys. It's in, yeah, here we go. If you scroll down to figure 2 on this CDC webpage that goes over antigen tests, you will find this documentation if you need that documentation. So even if you've tested positive within 90 days, if you're symptomatic, you should still get tested. It's not the doctor's decision. You can certainly leave that clinical decision to the doctor, absolutely. But if you're symptomatic, if you're newly symptomatic within those 90 days, then from a school's point of view, they need to be excluded for the 5 days. If the doctor's like, I'm not worried about it, don't test, that's fine, but they still need to be excluded for 5 days since they don't have a test result. All right, it looks like other questions are private, and I will follow those up myself. So if you have anything else, Kelly, feel free to close everything out.
Sure. Lex, let me know when you copy those private questions for you. Thanks for Jenna for for copying those questions. And Jenna will send us a copy of the chat. So if we missed anything, we'll be able to follow up. And everyone will get their slides hopefully this afternoon or first thing on Mondays. Mondays are always busy for me, so I've been trying to send them on Fridays so I can make sure you guys have them. And stay warm. We will see you in 2 weeks on February 4th. I can't believe it's February already. So if that is all, hi to my cousin Kim. I see she's on here. Love you. And we will see you all on the 4th. Thank you and have a good weekend.